When I finally did quit, my daughter said, "Mom, I'm so proud of you, and I'll support you." And so I made a promise to her that I would quit and stay that way, not smoke anymore.
We're helping 11 community mental health centers to adopt 100% tobacco-free campuses, and also to provide nicotine replacement therapy to those centers to assist people with quit attempts, not only their consumers but also their employees. So we're shipping about $7,000 worth of nicotine replacement products, being nicotine patches, nicotine gum, to the centers that we're working with. And the nicotine replacement products are probably the most useful resource that we are providing to the centers through this project.
When we first became a non-smoking campus, it was kind of rough. It wasn't just rough on the consumers, it was rough on the employees as well. Now that the consumers are open now to the NRT, the patches and the gum, I'm finding that a lot of them really wanted to quit smoking in the beginning or from the start, but they didn't have the tools that they needed to make it happen. And so I think, once we were able to push the NRT and to kind of let them know what to expect, and, letting them know that smoking it's not easy to quit, but, if you have the support and if you have the proper tools, you can do it. So how long you been,
2 weeks. Today is 14 days.
Yay! Good for you, honey. I know it ain't easy.
It's hard, right?
I know.
Right when I'm thinking about it, like right now.
Yes, girl, early mornings.
This gum will help me though.
Yeah, early mornings after I eat, girl,
I
it
know.
used to be my time. That's when I struggle the most.
After I eat, I really want it bad.
Mm-hmm.
I'm
That's
like,
the
oh,
time
and
I
then when I
struggle.
get bored,
Yeah.
I'm so used to smoking a cigarette.
Yeah, I know the feeling, honey.
I'm trying to get my health back together before it's too late. And that's what I would say to other people out there. One thing is stopping smoking, and another thing is for you to get you back together so you can live a long, prosperous life. Because if not, you can't do it with that. What's in them cigarettes nowadays? It's real bad for you.
Well, we were really excited to be part of the Taking Texas Tobacco Free project. We wanted to learn from the professionals that were going to be able to come into our center. We definitely took advantage of the $10,000 worth of free NRT because that was a huge factor for us. We wanted the advantage of having people who have been through the experience before and kind of know what they have done and give us an idea about how to set up a timeline. So we took advantage of everything, as well as any examples that we could get for policies and procedures, and just tips and techniques that we could use that had been tried before, that were tested and true. Well, the best part, of course, is that people are quitting. We've got staff who are quitting. We have clients who are quitting. We even have our medical director, who was against the program and thought it was not a good idea, who is now the biggest convert and thinks that it's the best thing that ever happened, and he's totally on board and prescribes Chantix and Wellbutrin and is happy to do it. And so seeing the transition of our staff has been amazing. Seeing the success stories. We've had celebrations at our center for people who have quit, and we have parties and we have cake and we have punch, and they tell their success stories, clients and staff together. And so those are the best parts about the whole program, is that you're actually helping save lives.